stress and anxiety due to their medical or surgical condition, which can lead to spontaneous aggressive behavior towards the nurses. You know, most of the time, the hospital is the last resort, especially in this our region. The hospital is the last resort for them to come to, because before they come to the hospital, they must have gone to various kind of traditional medicine. They have tried all sorts of traditional medicine. When it fails, it is then that they will now remember to come to hospital. And when they come to the hospital, they are already stressed up, and then they have this anxiety. So any slight thing can, result into physical violence. Now, the other one is poor communication between healthcare providers, patient, and relatives can lead to misunderstanding, frustration, which is a major cause of violent attack against nurses. This is very, very important because communication plays a vital role in, the kind of care we give. If, like we said, a patient that, have gone wrong, attempted all manner of traditional medicine and it fails, and they are now in the hospital. Depending on how you communicate with them, you have to be very careful how you communicate with them, because any slight thing, because they're already financially they're exhausted, and then they're having this anxiety. So any slight miscommunication can result into violence. Then the other one is unmet expectation. Patients and family may have unrealistic expectation about the care and treatment they will receive, leading to disappointment and frustration when these expectations are not met. Just like I told you, they might have tried all manner of treatments traditionally, and maybe somebody now informed them or educated them that there is need for them to go to the hospital. Now they will come with a very high expectation. Maybe they thought immediately they just come to the hospital. The hospital staff will just take care of that their health issue immediately. So when it is taking too long, it is going to be another cause of workplace violence. Then mental health issue. Patient or relative with underlying mental health issue, such as psychosis, personality disorder, may exhibit aggressive behavior. Like we've earlier mentioned, the different type of patients that are coming to the hospital, including the relatives. Some of them may be having mental issue that is not known, and any slight provocation or any miscommunication can then now result into violence. Then long waiting time. Long waiting time can lead to frustration and anger, which can boil over into violence. Now, the other time where we have a situation where a patient who was booked for surgery since 9 a.m., this patient has been staffed from 9 a.m. and unfortunately, we have only one operating table as of then. Unfortunately, when it was getting to 9 o'clock, the surgical team are all tired, and then there was another emergency which needed to be attended to. Now, that planned case that has been staffed since morning, when one of the surgical the theater team member informed the husband that this case, in the face of this emergency that is at hand now, his own, since it is a planned case, need to be be done the following morning. The husband became violent. He attacked that hospital staff. So long waiting time is another major cause of violence, because what the man was saying is that how can you people staff my wife since morning, and only since 9 o'clock she has been here, and remember that she stopped eating since 10 p.m. the previous night, and they were right there at the theater area since 9, seated. Only getting to 9 p.m., you are now telling me that the case has to be postponed to the following day. The man got angry and then attacked. Only God save that. So this long waiting time is another cause of major violence. Then the other one is mental. The other one is perceived lack of respect. In the categories of people that we mentioned that do come to the hospital, we mentioned some people that they are educated, and then maybe some of them are very high placed people. When they come, they expect some, despite the fact that they don't care whether the hospital staff is stressed up or not, they still expect that they should give them that respect of VIP treatment that they are used to. And when that does not happen, they resort into violence. Patient and relative may feel that they are not being treated with respect or dignity, leading to anger and then aggression. Then the other one is culture and language barrier. There are situations where the patient language, the staff on duty might probably not understand the language of the client or the patient that has come. Maybe due to that language barrier, it can equally lead to violence. Maybe they are not understanding each other, and that patient has a pressing issue. The relative probably will be, struggling to communicate what kind of stress or what kind of situation that patient is undergoing. If the staff on duty does not understand on time what they are, trying to tell him or her, it will lead to anger and then physical violence. Then lack of support. Nurses in most hospitals do not have adequate support or resources to manage difficult patient or situation, leading to feeling of frustration and burnout. Now, a typical example like the one of a language barrier. Now, if the staff on duty did not have the support of somebody who can interpret what that patient is trying to communicate to her, it will lead to violence. Then the other one is inadequate security. Some hospitals may not have adequate security measures in place to prevent or respond to violent incidents. Though in some, at least in this environment, we have security. Or the problem that we are having or is prevalent in this climate is that the security people, they due to one reason or the other, they may not be around when violent behavior will take place. Maybe they've gone to attend to something before they come, and attack has occurred on the staff on duty. So that is why the hospital management need to provide adequate security. Then lack of education. Patient and relatives may not understand the kind of care and treatment being provided, leading to confusion and frustration. Like I earlier mentioned, here or in most of our local community, people still depend on the traditional medicine. They are not educated enough on, the kind of treatment that is being provided in the hospital. So if they are not properly educated on the kind of care being provided, equally it could lead to violence. Then staffing ratio. Inadequate staffing ratio can lead to burnout and frustration among nurses and leaders, which can increase the risk of workplace violence. You have a situation, before I even go into that, I think it is ideal for us to just look at what is the ideal nurse-patient ratio as prescribed by WHO. The WHO has, provided the following nurse-to-patient ratio. In medical surgical units, we have the ratio of 1 nurse to 4 patients or 1 nurse to 6 patients. Well, in critical care units, we have the ratio of 1 nurse to 1 patient or 1 nurse to 2 patients. Then we have in the pediatric units, we have the ratio of 1 nurse to take care of 3 patients or at most 4 patients. This is the WHO prescribed nurse to patient ratio. But we have a situation because of shortage of manpower. One nurse managing a ward, and probably that ward might have a patient of maybe 20 or even more. We even have a situation in the local government area where you have one nurse managing 2 wards. Now, you can imagine what will happen if emergency come. We have a scenario. Let me, share another scenario with my audience here. We have a scenario where during an evening shift, a midwife in labor ward was carrying out the delivery of one client when another person, the husband of another woman who is heavily pregnant, came and started calling her to come out of the labor ward to come and attend to his wife that is in his vehicle. No, so the midwife now asks the hospital assistant to go and inform the man that he's already trying to deliver one woman who was already in labor. The man insisted. So luckily she was able to deliver that lady that was in labor after cutting the cord, and cleaning the patient. Then she came out to come and now attend to this one that his wife is in the vehicle. Her coming out, he just, slapped her. He physically attacked her. So you can see the kind of people that we're dealing with. So he physically attacked her.